The number of COVID cases are increasing rapidly in the last few days in Mumbai. Mumbai, in fact, reported 763 new COVID cases in the last 24 hours, the highest in 4 months. With a steady uptick in cases and monsoon on the doorstep, Municipal Commissioner Iqbal Singh Chahal has instructed that all concerned departments should be well equipped. He also added that the number of COVID testing should be increased so that the infection can be detected and arrested well in time. The Mumbai civic body has asked for COVID testing to be increased from currently around 8,000 per day to 30 to 40,000 per day.
2 घंटे का डिटेल्ड मीटिंग हुआ है विद सारे प्राइवेट हॉस्पिटल, जंबो हॉस्पिटल के डीन्स, मेडिकल कॉलेज के डीन्स, उसके बाद हमारे सारे हजारों हेल्थ वर्कर्स, उसके बाद में हमारे वार्ड ऑफिसर, डिप्टी कमिश्नर, जॉइंट कमिश्नर, एडिशनल कमिश्नर. There is nothing to worry, nothing to panic. Everything is under control and there is no worry at all.
But as the
डेथ रेट हमारा नेग्लिजिबल है. पिछले 15 दिन में एक डेथ है. उसके अलावा हमारा हॉस्पिटलाइजेशन सिर्फ 3% 4% के बीच में चल रहा है, विच इज वेरी कंफर्टेबल और कोई सीरियस नहीं है. इट इज लाइक अ फ्लू लाइक सिचुएशन.
ठीक है, तो सर बेड की व्यवस्था कैसी है? अगर
बेड की डिमांड ही नहीं है. 3,000 में सिर्फ 60 बंदे बेड पे हैं. हमारा 10,000 बेड है हमारे पास,
तो केवल 7 बेड की ऑक्यूपेंसी है.
69 बेड ऑक्यूपाइड है और 10,000 रेडी हैं.
अच्छा. तो अगर कोई इमरजेंसी जैसी सिचुएशन आती है तो बीएमसी पूरी तरीके से तैयार है.
हमने सारे आईसीयू, सारे हॉस्पिटल, 16 पेरिफेरियल, 5 मेडिकल कॉलेजेस, 144 प्राइवेट हॉस्पिटल सबको एक्टिवेट कर दिया है.
सर, मानसून के लिहाज से अगर बात करें तो मानसून आने वाला है, तो आप किस तरीके से असेस कर रहे हैं कि आपको संभावना है कि कोविड केसेस बढ़ सकते हैं?
बिल्कुल बढ़ेंगे. ये फिगर हो सकता है कि फिगर ये 1,500 2,000 तक चला जाए, उसके बाद में डाउन जाएगा. परंतु घबराने की कोई बात नहीं है, बिकॉज ये फ्लू लाइक है. इसमें मोर्टेलिटी भी नहीं है, डेथ भी नहीं है और इसका हॉस्पिटलाइजेशन बहुत कम है.
All right, joining us for more on this is Abhishek from Mumbai. Abhishek, so 700 cases for the third straight day. The municipal commissioners there saying that the cases could go up to 1,500 to 2,000 per day. How worried or concerning is the situation here and how ready are the state authorities?
Yes, definitely it's something which is not good for the city of Mumbai. And as we also yesterday, pointed out, and the letter that has come from the central government to the state government of Maharashtra, where it clearly identifies 6 hotspots where the cases are constantly rising, and 6 districts, I would say directly. One is Mumbai City Suburban, Raigad, and Palghar, and Thane, and Pune. So, these are the 6 important where center has clearly said to the state government of Maharashtra that you need to, ramp up your containment measures in these district. And prominently speaking, Mumbai is a major hotspot because as far as the active cases are concerned, there are more than 5,000 active cases in Maharashtra, out of which nearly around 4,000, like 3,700 cases are only in Mumbai. But one short of relief is that these are the asymptomatic cases at the moment. They don't require hospitalization and people are getting recovered in home isolation and home quarantine. That's what Mr. Chahal meant. These are flu-like situation and they are getting recovered and they are not impacting directly on the hospitalization rate. But the worry is the monsoon. Monsoon is arriving and what is BMC anticipating is that because as it arrives, there will be more symptomatic cases. People will fall sick, people will fall, get trapped on the flu symptoms, and then the worry will start. So that's the reason yesterday a review meeting was held, and there were many instructions by Mr. Chahal to the entire team of the BMC, right from ramping up testing in those areas where COVID cases are being detected, collective testing to be done at those areas, and increasing in the number of testing, because right now around 8,000 is what we are testing, which is very, very less as compared to any waves. We have gone to testing up to 50,000 the maximum we have touched in Mumbai, because as we test more, we identify the infectious people more and, they are isolated. So the spread is stopped. That is what is important. And at the same time, a review of the jumbo COVID care centers to private hospitals are being put on alert and importantly, the BMC is using all, anticipating monsoon. So prevention measures when it comes to diseases which are spread in monsoon is something which was reviewed yesterday, and to be prepared for any events of eventualities, natural calamities which happen in monsoon is something was discussed. So definitely they are anticipating a huge surge. As he spoke that 1,500 to 2,000 cases he is anticipating. But prominently after the task force meeting, I would also highlight the state task force has said that we will wait and watch for 15 days. And the CM has warned the people of Maharashtra that if you guys don't follow COVID protocol, don't wear masks voluntarily, you have to bring in COVID restrictions. So as far as Mumbai is concerned and Maharashtra, but Mumbai becomes the epicenter because more than 750 cases yesterday.
Yes.
Right from the past 3 days, 700 and above cases in Mumbai, 1,000 above cases in Maharashtra is definitely something, we are need to worry about, but hospitalization rate is comparatively low. So that's the sort of relief at the moment. Back to you.
All right, Abhishek, thanks very much for joining us with those details. So hospitalization is currently low, but the cases are seeing a steady uptick. The authorities have begun preparations, expecting a surge of about 1,500 to 2,000 per day in Mumbai, and civic authorities also ramping up testing in the city. Now, amid spike in COVID cases and the growing positivity rate, Health Ministry has written to Maharashtra and 4 other southern states, including Tamil Nadu, Kerala, Telangana and Karnataka. The ministry has asked the states to take prompt action and ensure an effective management to contain the infection. Meanwhile, Union Health Minister Dr. Mansukh Mandavia has reiterated the need to reinforce messaging on COVID vaccination campaign to encourage vaccine uptake.
हमारे पास हेल्थ वर्क फोर्स है, अच्छे डॉक्टर है, अच्छे फार्मासिस्ट है, अच्छे फिजियोथेरापिस्ट है, अच्छी नर्सिस है, नंबर ऑफ टाइप के हमारे हेल्थ वर्क फोर्स है। दुनिया के पास हेल्थ वर्क फोर्स नहीं है, उसकी रिक्वायरमेंट है। हमने तय किया है हिल बाय इंडिया, इंडिया के हमारे हेल्थ वर्क फोर्स विश्व में जाए और दुनिया को स्वस्थ करे, उसके लिए भी एक बहुत बड़ा अभियान चलाना है।
And we also spoke to health experts on the rising COVID cases. Listen in.
So, this is a dynamic situation. It changes from day to day. The criteria that are to be followed is to see if on the consecutive days, like there was a positivity rate which has gone up to close to 5% in Mumbai. Now, when that happens, you need to enforce at least the first line of defense, and that's masking and distancing and containing the number of people in a given place. Also, you don't encourage, you can go to half the strength in buses and be careful. So that warning has to go out for people to be careful. Now, the second thing is, if the numbers rise consistently for 4, 5, 6 days and they reach the danger levels, then you need to enforce that the aircraft having middle seat empty and all that. And I hope we don't have to go back to that, because if we take early action, now the data is available at a very straight real-time basis. We can monitor situations, we can pick up hotspots, and we can actually take action in those areas rather than general clampdown on the country. So I think that it's important that in Maharashtra, wherever the hotspots are, we isolate them. But for general public, masking and distancing should be the norm of the day for a little time to come till we know that it is receding again.